I'm Dr. Nashwa Abu Khadr, Professor of Microbiology and Immunology, Faculty of Medicine, Alexandria University. Hepatitis A and hepatitis E, which they are also named enterically transmitted hepatitis. Viral hepatitis is a systemic disease which is primarily affecting the liver. The word primarily affecting the liver, that means that when such group of viruses enters the body, the first target is the liver cells. These viruses will not replicate except inside the liver cells. Why? Because as we all know, that viruses has the property of tropism, which meaning that there is a specific cell for each virus. That's why they classified the hepatitis virus into two groups. Most cases of viral hepatitis, which affect the children and the adults, are caused by what is so-called the hepatotropic viruses, in which the virus does not replicate except inside the cell. There are 5, in which they are hepatitis A virus, hepatitis B virus, hepatitis C, hepatitis D, and hepatitis E. As we are going to mention later, hepatitis A and E are enterically transmitted hepatitis, where the others, which are B, C, and D, are parenterally transmitted. Other group of viruses also may infect other sites of the body, for example, the gastrointestinal tract, the respiratory tract, whatever, and with its complication or with its pathogenesis, it also may affect the liver. They are known as not exclusively hepatitis viruses or the non-hepatotropic viruses. These include the yellow fever, Epstein-Barr virus, and as well as cytomegalovirus. Unfortunately, there are other toxic substances, as for example alcohol, certain drugs, autoimmune diseases also may cause hepatitis. What is hepatitis? Hepatitis is simply, it is inflammation of the liver cell. And as you are going to see later on, the clinical picture of all the forms of hepatitis are exactly the same. So first we are going to speak about hepatitis A virus. It is a liver disease which is caused by hepatitis A virus. These viruses are primarily spread when uninfected or unvaccinated person will ingest contaminated food and drinks. This means that the patient must be free from hepatitis A in order to catch the infection. Infection is usually spread or transmitted, as we said, through contaminated food or contaminated drinks or utensils contaminated with the stool of the infected person. The disease is closely associated with unsafe and food, inadequate sanitation, and poor personal hygiene. That is why it is always spread in overcrowded areas and in areas in which they lack the personal hygiene or they lack the hygienic manners. It is rarely fatal. Fortunately, it is rarely fatal. It does not develop any chronicity, and it is self-limiting, and also it produces, as you're going to see later, a lifelong immunity, and it is because it is just one serotype. It is rarely fatal, but of course it might cause some debilitating symptoms, and very rare percent or very low percent may causes what we call it acute liver disease or acute fulminant hepatitis, which unfortunately may be fatal. The disease leads to significant economic and social consequences in the community because, of course, the patient will remain ill for at least 1 month, 2 months, maybe up till 3 months until they return back to work and to school daily life. The cycle of infection, the causative agent. What is our causative agent? Our causative agent in hepatitis A virus infection is the hepatitis A virus, which is classified with the family of Picorna genus or Picorna viridae group. The Picorna, the word pico means very small, and which is a group of viruses. They have a characteristic of being very small RNA viruses. They are one serotype, which is very important, means that the patient once infected with hepatitis A virus he is not going to be infected another time with another serotype. It is small, non-enveloped, icosahedral nucleocapsid and single positive sense RNA genome. Here it is, you can see, it is single-stranded RNA, non-enveloped, but of course it contains a capsid. The virus is stable to treatment and with ether. Fortunately, most of the hepatitis viruses in general, they are very sensitive to heating, to boiling, to autoclaving, to heating up to 60 degrees centigrade just for 1 hour, chlorination, the using of the household chlorine, this simply household chlorine, which is cheap. You can use it for disinfecting and killing of the virus. Hepatitis A virus may persist in the environment and can withstand the food production processes routinely used to inactivate and to control the other bacterial pathogens. This is a picture of the hepatitis A virus using the electron microscope. As regards the virological and the serological events following the exposure to hepatitis. The serological and the virological events are very important for the diagnosis because these are the markers the lab is looking after and the clinician can diagnose his case of hepatitis or the stage of infection in the hepatitis. Virus particles are almost found in the stool 2 weeks before and 2 weeks after the infection. This means that the virus can be transmitted by contaminated food and drinks or by the contaminated stool of the infected patient 2 weeks before and 2 weeks after the onset of jaundice. What is jaundice? Jaundice, it is the yellowish discoloration of the skin and the mucous membrane due to the elevation of the level of the bilirubin. 90% of cases of hepatitis will develop jaundice, but there are some percent of cases of hepatitis might not develop jaundice. During which the patient is infectious, the jaundice might appear, or the jaundice always appear. So jaundice, it is the yellowish discoloration of the skin and the mucous membrane. You can see even all the mucous membrane on the skin of the patient is deeply yellow. Fecal shedding is maximum during the late stage of the incubation period. There is an incubation period in which the virus can be isolated from the stool of the patient. Therefore, during this period, it is highly infectious, and during the acute illness. Peaking just prior to the onset of liver injury. Viremia, what is meant by viremia? Viremia is the presence of the virus in the blood or circulating of the virus in the blood. The viremia also persists during the incubation period and into the acute illness. But like the fecal shedding, it is likely to reduce in magnitude with the onset of hepatitis until the appearance of the anti-hepatitis A virus antibodies, which are the antibodies against the hepatitis A viruses, and fortunately these are neutralizing antibody. Once the antibodies start to appear, mainly the immunoglobulin G, meaning that the patient will start to undergo the stages of recovery. The antibodies are two types. We have the antibodies against hepatitis A virus, immunoglobulin M, which appears very shortly before and concurrently with the onset of symptoms and reaches its maximum, and maximum the appearance of the hepatitis A virus, immunoglobulin M antibodies ranges from 3 to 6 months. The antibodies against hepatitis A virus, immunoglobulin G, which appears simultaneously, but it will remain for lifelong and it persists for many years. That's why we call it the lifelong immune. So the presence of the anti-hepatitis A virus antibodies, immunoglobulin G, in the serum of the patient indicate that this patient had suffered from past infection of hepatitis A virus and he had already developed lifelong immunity. Here, this curve can show us the different events in the hepatitis A virus infection. Here you can see hepatitis very early during the incubation period, the presence of the virus circulate in the stool. The liver enzymes will start to, so the viremia is present during the incubation period and early in clinical illness. The hepatitis A virus also can be found in the stool, or almost found in the stool during the incubation period and during the acute illness, and also it remains sometime after the recovery. The liver enzyme, it is low, then it starts to be elevated to reaches its maximum during the acute illness, and this elevation of liver enzymes, which will lead to elevation of also the bilirubin and the yellow discoloration of the skin and the mucous membrane. Later on, also the immunoglobulin M, as I had mentioned, start very early in infection. This green dots, very early infection, reaches its maximum, the immunoglobulin M reaches its maximum during the acute illness, and then start start to subside. It takes for about 3 to 6 months in order that the immunoglobulin M completely disappear. The immunoglobulin G may start to be elevated shortly after the immunoglobulin M, but it remains elevated, as you see here, until it causes lifelong immunity. Again, we have the viremia present during the incubation period and during the acute illness. The hepatitis A virus can be isolated from the stool during the incubation period and also 2 weeks after recovery. The liver enzyme is elevated and reached its maximum during the acute illness, and then the liver enzymes start to decline. The immunoglobulin M appears after the incubation period together with the acute illness, reaches its maximum during the acute clinical illness, and then start to decline and reaches to the 0 level. It takes for about 3 to 6 months to disappear. Once the immunoglobulin M disappears, this means that my patient is under the stage of recovery, and the immunoglobulin G will start to be elevated. The immunoglobulin G will remain elevated for long or for a long period of time. That is why it causes lifelong immunity. Here again, you can see the liver enzymes are also elevated and then return to the normal. The immunoglobulin M reaches its maximum during the acute illness and then start to decline. The total of the immunoglobulin G remains for life.